Hello, my name is Kelly Malcolm with the Michigan Medicine Department of Communication, and I will be your host for today's live stream. Cases of COVID-19 are spiking around the world and in the US. There have been more than 8 million cases in the US since the beginning of the pandemic. Currently, more than 44,000 people are hospitalized with COVID-19, with more than 1,300 in Michigan alone. In Michigan, about 25% of hospitalized COVID 19 patients are in intensive care units. Thankfully, many of these people will survive their illness. So will most of the tens of thousands of people who are coping with COVID 19 at home. However, these patients and their families are facing serious challenges on the road to full recovery, and many feel their lives will never be the same. Our experts today are studying caregiving of patients with COVID 19, from learning how to manage with isolation and quarantine, to hospitalization, to what happens after the initial illness subsides and the long term recovery journey. Today, we are joined by three experts. Dr. Sheria Robinson Lane, Assistant Professor of Nursing at the University of Michigan in the Department of Systems, Populations, and Leadership. She specializes in advanced illness management, long term care, and nursing administration. Her current work seeks to understand how adaptive coping strategies are used by Black older adults and their caregivers to influence health outcomes. Dr. Amanda Leggett, a research assistant professor with the Department of Psychiatry, specializing in studying the mental and social impacts of being a caregiver. She normally studies the home caregivers of people with dementia, but has pivoted to study COVID caregivers. And Dr. Jack Iwashyna, a physician who works in medical intensive care at both the University of Michigan and the VA Ann Arbor. He does a mixture of clinical practice, teaching, and research about improving care for patients who survive critical illness. All three of our guests are investigators for the Health Enhanced by Adjusting and Recovering Together, or HEART study, a project which is collecting the stories of COVID 19 patients and the people who care for them to quickly develop caregiving resources. This research is funded by the University of Michigan's Institute for Social Research, Michigan Medicine, and the Procter and Gamble Company. You can learn more about this study at heart.isr.umich.edu. Since we are doing this live stream remotely, please pardon any technical interruptions that might happen. First, a few housekeeping items. You can submit questions at any time, even now, for our experts to answer during the Q&A portion of today's chat. Questions can be submitted by commenting on this video, but please note that your name or profile name will be visible to others participating. If you prefer a more anonymous option, you can send a private message to us via Facebook or email us at ask-mishmed, that's MICHMED, at med.umich.edu. That was a mouthful. Let me say it again. Ask-mishmed at med.umich.edu. If you can't stay for the whole chat or want to share the recording with a friend, a video of the chat in its entirety will be available on our Michigan Medicine Facebook page, our @UMichMedicine Twitter account, and the Michigan Medicine YouTube channel. Now, finally, let's move on to our questions with our experts. And our first question for today: what should I do to prepare to care for myself or someone in my home that becomes infected with COVID? Sharia, why don't you take that?
Sure. Good morning. Well, one of the things I think is important for people to remember is that COVID-19 falls into the same category of viruses as the common cold. And so the same sorts of things that you would want to have at home if you were to catch a bad cold or to catch the flu are the same sorts of things that you want to make sure are in your home now. So having some sort of a cough suppressant, making sure that you have something for pain, both Tylenol as well as ibuprofen, which is like Advil, and unless there's like a medical condition or you're taking some medications where your doctor has advised you that you shouldn't have ibuprofen. So at least have some Tylenol available. If you have small children at home, make sure that you have the liquid versions of that in a child amount, so that you can have that available for your kids. Have some cough drops, and whatever other home remedies that you think that you might want to have available for yourself. The other thing that people haven't really thought about at home is if somebody were to get sick, where could you put them in your home? So you want to start kind of thinking through, like, if I have to isolate somebody in my house, what room could I turn into a sick room for them where we can kind of keep them away from everyone else and keep them from getting sick? And do we have things like paper plates and some paper forks and stuff to be able to take care of them? Do I have an extra bathroom to where they can use their own bathroom? And then if we have to share a bathroom, how can I keep that area extra clean? So do I have some sprays that I could sanitize the area after they're using it, or wipes to make it even easier? And then do we have enough face masks at home so that if it's very difficult for us to keep that person separate, can we put a face mask on them if they can breathe okay, so that they're not spreading their germs around to everyone else? And then making sure that we're in the habit of getting the kids, if we have young kids at home, to follow directions so that they don't go jumping on that person that maybe needs to keep themselves separate. So we got to practice some of those listening skills before that's a big worry. The other thing that a lot of people might want to think about is having a thermometer, because if you haven't used one in a while and your mama is old school, we like to use the back of our hand to check, and that works well. But it's important to maybe have some tools that get some more accurate numbers, so that if we need to relay information, that information is correct. So you can get a thermometer that goes under your tongue. They also have tympanic thermometers are becoming very more common. Those are the kind that you can swipe across your forehead. Those tend to work pretty well and are fairly accurate. Sometimes people have some concerns about those not being accurate. Um, so making sure of that. And then the last thing that people find pretty helpful is to get something called a pulse oximeter. Now, that is a device that you stick your finger in that tells you whether or not you're getting enough oxygen. And one of the problems with COVID is that people can get very sick all of a sudden and maybe not recognize that they're sick enough to need some extra support. And so that pulse ox can give you some additional information to know that you need to head in. You do need to have a smaller size if you have small children at home, and you can order both sizes. Usually at most drugstores have them, as well as you can get them from Amazon, and they range in price from starting around $20 now. They used to be a lot more expensive, and all the way up to like around 75. So those are some of the main things to think about having at home.
Great. I actually went out and bought one myself, so got my pulse ox here. Um, Amanda, do you have anything to add?
Sure, I do. I also did as well. I went out and bought a pulse ox and made my parents do the same, from what we've been learning and how helpful they've been to some of the people in our research. But another thing I would think about, I think early on back in March, there was a little bit of panic and people rushing to the store to buy many rolls of toilet paper and things like this. But I think it's also helpful to think about, if you do need to stay in your home and quarantine for a period of time, do you have some of those basic necessities that would enable you to stay safely within your home? And also, I would be thinking about, who are my contacts? So who is a close family member or friend or neighbor outside of my home that may be able to help me in doing a grocery run, or helping me with my lawn, or some of those other things that you may need help with if you and your loved one need to stay in your house.
Great points. Thank you. Okay, so the next one, how do I know it's time to go to the emergency room if I have COVID-19? Who wants to take that?
Sheria, do you want to talk about, I know how to tell if you need to go to the ICU once you get to the emergency room. Do you want to talk about how to decide whether it's time to come into the ED?
Sure. So the main things that you want to pay attention to is whether or not you're developing a fever that goes above 100 degrees, and if you're starting to have some difficulty breathing. So at any time that you feel as though you cannot breathe, it's time to head into the emergency room. And this is really critically important if you have any respiratory condition. So if you already know that you have asthma, or you have COPD or emphysema or something like that, and then it's more challenging to breathe than usual, you need to head in. Families, you have to pay attention, because once folks start to have difficulty breathing, they don't think in the way that you think that they're thinking. And so you might have a family member that usually is contrary, like they don't like to follow your directions anyway. So it could be hard to know whether or not you need to push them to go, and you need to push them to go. If it seems as though they're becoming more confused, it seems as though they're getting winded very quickly as they're moving around, and you know that they've had a fever, you need to head in. And even if they don't have a fever, if they're experiencing some difficulty breathing, you should head into the emergency room. It's best to contact your physician and have that conversation with them and be clear about um, if you think that you've had an exposure to COVID-19, you want to lead in with that, and then talk about the symptoms and be specific to say that you're noticing that the person is having some difficulty breathing, if you're noticing that they are having some increased weakness, and if you have taken their temperature with a thermometer, you want to tell them what the temperature is, and then hopefully you also have a pulse ox too. And if that pulse ox reading goes below 90%, so it's like 89, you need to head to the hospital. And that's one of the reasons it's helpful to have that pulse ox too, because you one, it can let you know where things are. And then also it provides, when you're calling your doctor or your healthcare provider to let them know about your symptoms, is helpful. The other reason it's helpful to call ahead is because when you call your doctor can actually call the hospital and let them know that you're heading in, which will help to route you into the hospital. It'll facilitate that process a little bit, and then it'll also for sometimes for insurance purposes, that's helpful to make sure that it gets maybe covered if you had that referral from your doctor versus heading in.
Yeah, I mean, Sheria is right about all that. I'd say a couple things as somebody who sticks breathing tubes into people's mouths kind of as a profession. Some of the things we see where we go, oh God, I wish we'd seen that earlier. The big thing is if it's an or. So if any of those things is going on, go to the emergency room, not an and. So we know that like 25% of people who get intubated, right, get put on a breathing machine for COVID-19 did not have a fever when they showed up at the hospital. So the fact that you don't have a fever, but if you still can't breathe, go to the emergency room. Likewise, just because your pulse ox reading is normal, if you can't breathe, go to the emergency room. And I worry that I'm going to sound like I'm making this too simple, but if you can't breathe, go to the emergency room. And Kelly, do we have time for me to tell a quick anecdote about me being an idiot?
Yes.
So, right, like coronaviruses have been around for a while, and I got a different one a year and a half ago. And I stayed at work all day because I was going to do my job. I made sure I stayed 12 feet away from people, but I come home and I went to bed and I woke up and I got winded 3 times and I had to stop 3 times trying to go to the bathroom. I was like, I'll probably be better in the morning. And so I went back to bed. And then I woke up again an hour and a half later and found that I had to do what's called tripoding. I was sitting on the edge of the bed, putting my elbows on my knees. I was like, maybe I should tell my wife. I was sick, so I was sleeping in a different room. So I walked up a flight of stairs and had to stop like 4 times going up the flight of stairs. And I was like, honey, I'm not sure if maybe I should go to the emergency room. And she's like, you're an idiot, get in the car. Right. And I was a 45-year-old physician. I should have known better, but I didn't want to be a bother for people because I was the person who took care of folks. And I think particularly for parents and particularly for the folks who are used to being the folks who give, knowing that sometimes you may need is hard. And so, my wife told me I was an idiot and dragged me to the hospital, and that was good for me.
So you have permission to drag your relatives to the hospital. Please do.
Mhm.
Okay, so your next question.
I just
Uh,
wanted to, before we
yeah,
moved on, I just wanted to mention one more thing. I know that sometimes people of color have had some challenges in getting seen in the emergency room or being heard and believed. And so one of the things I really want to stress is it's really important that we pay attention to keywords when we're relaying what's going on. You have to say that you're having difficulty breathing, that you have been exposed to coronavirus. Now and if you're not sure, that's okay. We don't want you to make anything up, but you got to be clear that you aren't able to breathe, and talk about what your health concerns are. The other thing that a lot of people don't realize is that when you downplay your symptoms, so when you call your doctor, you go to the emergency room and then you say, well, this, but it's probably nothing. They sometimes only hear that it's probably nothing. And so if you're not worried about it, they're not going to be as worried about it. So you let them, if you need to be treated, let them figure out what's going on. You don't get figure out what's going on, and that can help to reduce some of that. I think that we may be seeing less of that, but it's important to be persistent, and it can be helpful to have someone to accompany you, and that's where the caregivers come in, to be persistent about that person being seen and treated.
Yeah,
right.
you're entitled to
Right.
superb care. And so this is worse than it usually is. And if it's worse than it usually is, just tell us that over and over again, because we don't know who you were a week ago. But if it's different than it was and it's worse, tell us that, and that entitles you to superb care.
Right. Okay, so my relative who I live with tested positive for COVID a week ago. I'm not experiencing any symptoms and tested negative yesterday. Do I still have to self quarantine for the remaining 7 days? This is kind of specific, but
Yes, you do. I get that question a lot as a contact tracer. One of the things that is we ask, because I'm working as a volunteer with the local health departments, to monitor the spread of coronavirus. And so one of the things that we know is there's about a 14-day incubation period from the time that you can be exposed to the illness and when you get sick. Now, most people tend to have symptoms in the first 5 days of exposure. Sometimes people get sick about 2 days after exposure. But the reality is, anywhere in those 14 days, you can end up sick and transmitting it to someone else. And this is particularly a problem when it's a relative that you live with, because the longer that you're around that person, even if they are self isolating in another part of the house, they're wearing a mask, and you're doing a pretty good job of cleaning, you still are living, with them and may have some exposure that you've missed. And so you absolutely, even though you've tested negative now, you still may end up testing positive later. That just means that at the time that they took your test, there wasn't any virus evident, but that doesn't mean that you still can't get sick during that time period. So it's really important that you continue to self isolate for the whole 14 days, and that if you have small children that are at home and you become sick yourself, or you need someone to care for your children and are able to do that, that they will need to self isolate with your children for those 14 days, because those kids have been exposed and could potentially, make that other person sick, even if they were tested. And then, you're sending them to someone, and whoever you send them to, you should make sure that that's not a person that has a high risk factor for dying from coronavirus. So you don't want to send them to your grandparents, to your parents necessarily to watch them. You probably want to try and send them to an aunt, or somebody that has not likely to have severe effects from coronavirus. That's someone who's generally healthy without any chronic health conditions.
And we know it sucks. We know it
yeah.
sucks. There's no other word for it. Nobody chooses to live during an epidemic. We can choose how we try to keep people safe.
Yeah, good point. Okay, you kind of touched on this a little bit, but just to reiterate, I have a relative that I live with who's positive for COVID. How do I keep myself and the rest of our family from getting sick? You mentioned separate bathroom. How often do you
Yeah.
have to clean? that sort of
So,
thing?
so there's several different things that you can do at home. The main thing is if you can imagine that person has paint on them and you don't want them getting paint on anything else in your house, then that's a way to kind of think about how do you keep them away from touching things. And so start with the very basics with meals. If you live in a household where like you guys still share meals and everybody's kind of going and fixing their own plates, that's the first thing that has to stop. One person needs to make the plates, go old school where mom makes the plates or dad, whoever is okay, makes plates for everybody to limit contact with that food item. Um, you don't want to share dishes wherever possible. It's good to go with paper if somebody is sick in the house. That way you can just toss everything. If you're not, it's okay. You can use regular dishes. Just make sure that you're doing excellent hand washing. Have that person take their meals in their room or wherever they're self isolating. If you have a window that you could crack in that room or a door that you can kind of open to get some air circulating, that's helpful to do. I know that the weather is changing, and so it's not easy to do it for longer periods of time. So even if it's for a few minutes to let that window open and get some good air circulating around in there, that's a great idea. In the bathroom, every time they go in there and use the bathroom, they should be wiping. Like, the nice thing is to use like some sanitizing wipes, because then like when they go, then they can like wipe off the handles of the toilet and the sink and the doorknob as they're leaving out. So it's very, very meticulous process, but a lot of people are able to do it and keep that illness with one person in the household. Of course, the more people that are there, the smaller your space is, and the more you have little folks running around because they take germs with them, the more challenging that is. But it's very possible to stay safe at home. The other thing that I think we don't talk about enough is having that person use a mask if they're not having any difficulty breathing, because that really helps them to keep their germs to themselves. And it may be easier to get a disposable paper mask, because sometimes that one might be a little bit easier to breathe in than the cloth mask. And then we can just toss it right once they're done using it. And if it becomes like damp from coughing or just from breath, so you might need to get a few extra paper masks for them to use.
Amanda, how do you keep your head in the game as a caregiver when you're doing this? We were talking before the call about that I just finished having to try to keep my wife and youngest child in their bedroom for 36 hours while we waited for our COVID test to come back negative. And boy, was I ready to burn the house down at the end of that time. Sorry, I probably should have said that on the world's largest media platform. How do you how do you, as a caregiver, how do you deal with that 14 days of really long time and that anxiety?
Yeah, it can be really, really difficult. I think something that's very simple but very helpful is having a routine, just a daily routine. So, a normal sleep and wake schedule, a normal meal schedule, getting yourself in the routine can be helpful, not just in COVID, just even in regular life, but it helps you focus on, kind of the schedule of the day and what you need to get through, and remembering to take care of simple things like sleep, healthy meals, exercise. Even exercise that can be done inside the house is helpful for boosting mood and well-being and health. So I would say, yeah, a normal routine is a huge one. I would say making sure that you are caring for yourself too. We see way too often in caregivers of many kinds that they put their mental health on the back burner while you're focusing on providing care for someone else. But a saying that I say all the time is that you can't pour from an empty cup. So if you're empty yourself, you're not able to provide care for someone else. So it's critically important to also make sure that you're thinking of your own well-being and your own health as you're going throughout this period. And so find some things in your day that you enjoy that can be done in the home. And maybe it's things that in ordinary life you don't have time to do, like catching up on a favorite television show, or doing a puzzle, or playing some sort of game, or even gardening if you can be outside. So finding things that you enjoy that you can incorporate in your routine. And then another thing I would say is stay connected. So you don't have to be in your house alone. in the sense that you can have phone calls, you can have Zoom or web chats with friends and family. Make sure you're talking to someone outside of who's in your home every day. So get some other social connection in your life to share kind of your emotional concerns or your thoughts, what's going on, but also to have someone to make you laugh or to make you feel good. That's really important too. So I would say those are simple things, but routine, making sure you have a schedule, taking care of yourself and your well-being, finding things you enjoy, and staying connected with others would be some really simple, easy tips that I would provide. Going on a walk, if you're able to leave the house, that's huge too. And again, as Sheria said, it gets harder, especially in Michigan as we're reaching the winter months. But if you have any ability to be outside in the sunshine, that's helpful too.
I guess, I mean, I think the other thing that I at least have watched is, and I'm hereby giving you all physicians a physician order, it's okay to be mediocre at some things, right? Like some things just aren't going to get done, right? Like the laundry is not going to get done as nicely. There's going to be a big pile of clean rags as opposed to them all being nicely folded. And oh my God, if you could just see what's just off screen over there, it's very important that the camera focus just this way. And I'm sure many of you do this better, but realizing that like there are essential tasks, and the essential tasks are to take care of the people you love and the people and yourself. And there are non-essential tasks, and raking the leaves up and doing some of the other things you kind of love, those can wait a month.
Right, absolutely.
And the other thing I think we have to, I think what Amanda said is so important. And for many of you, I think you actually need to go write a list. You need to sit and make a list of the things that you enjoy doing because you probably forgot because you haven't had the time to do them in such a long time, and people that you need to check in and follow up on. Because one of the ways that a lot of folks are coping that we have to maybe think about reeling in a little bit, particularly as for many of us on the northern part of the states in the world, is that we're doing a whole lot of drinking and eating right now. And that is not necessarily healthy. And so this is just a reminder that, you know, those things are temporary, but we don't want to have long-term effects on our health or pick up habits that then we have to figure out how to adjust, you know, later on. And so just be thoughtful about, you know, is the thing that you're doing something that's ultimately best for your health? And so what are some healthy things that you can do for yourself, and make a list of what those things might be of realistic that's to you, not what somebody else says that, you know, you should do, but what are some things that you actually enjoy doing that's realistic for yourself?
Right.
And
Okay.
I think another thing that I thought of as well that I know in talking with people in my circles has been difficult is sometimes you need to dilute the news. Sometimes it's helpful to turn off the news. That can really get our brains going and make things worse sometimes when we see everything that's happening. And I'm not saying do away with it entirely. Of course, it's important that we stay informed and we know what's going on in our world, but maybe we don't need to have you know, the news channel on 24/7 because that can make it harder for us to cope
Yeah.
sometimes.
Yeah. There's definitely a lot going on right now. Okay. So our next question, I've been hearing about long, quote unquote, long haulers and long COVID, people who had the virus months ago but are still feeling not quite right. Is this a real thing? And what do we know about it? And what kind of care do these patients need?
You know, it's a great question, and it's a thing we don't entirely know the answer to. It's a thing. It's absolutely a thing. But what kind of thing it is something that in part is why we'd love some of you to go to heart.isr.umich.edu and tell us your stories. Because frankly, the early data has been a little spotty, and it's largely been physician scientists going, I don't know, I think a virus might cause these symptoms, and then asking those symptoms, and 30 to 50% of people have whatever it is you ask about. But we don't know how many of them had it before they had the virus, and how many of them have it because also you may have noticed the economy has collapsed, and so that tends to make people depressed and unemployed, and there are lots of other challenges going on simultaneously. I think what we do know is that people who've had any kind of infection that's bad enough to be hospitalized, what we call sepsis, or people who've had that bad enough to cause respiratory failure, or ARDS, for those of you who want to Google things. So sepsis or ARDS. There's a post-sepsis syndrome or post-critical illness syndrome that's not restricted just to people who are in the ICU. Anybody who was hospitalized, in some cases even people who weren't hospitalized, have an enduring range of symptoms that are new and that seem like they're caused by the combination of the virus and the body's response to the infection and the limitations of care, the side effects of the care we have, and then kind of slow recovery. We know it's quite common among people who are infected. Maybe a third of older Americans will have new cognitive impairment. Maybe a third to a half will have some kind of new limitation in a basic activity of daily living. And maybe a third will have some kind of emotional problems and emotional challenges, but those will all be overlapped and interrelated, right? It's not like if your brain doesn't work, you can keep going to work in the same ways. And we know that some, but not all of these will get better. And that it's really important to find ways to stay engaged. We know that a lot of primary care physicians have never heard of the post-intensive care syndrome, have never heard of post-sepsis syndrome, and so don't necessarily know how to help folks with it. And so there are specialized recovery clinics, ICU recovery clinics, or the post-ICU longitudinal survivor experience at the University of Michigan, to again put in a shameless plug for some of the amazing people I work with, who can help folks think about how to build rehab and how to make sure there aren't avoidable errors. Some stuff's not going to get better, and it's about adaptation. Some stuff is, and medical professionals, physical therapists, nurses can help you figure out how to make it better. But we're going to need to discover a lot of this over the coming time. And what a population might do doesn't mean you're going to experience it. It's not like a third of you is going to experience cognitive impairment and the other 2/3 of you isn't, right? It may happen, it may not. And it's about giving oneself permission to try to get as much better as you can.
Great. Okay, so our next question. My relative is in the hospital with COVID. What do I need to do to prepare for them to come home?
So I can talk a little bit about sort of the medical transition parts, and then maybe Sheria can talk about getting the house ready, and then Amanda can talk about getting one's soul ready and getting yourself ready as a caregiver for what's going to be a long, potentially weeks to months of that. I think the big challenge of being in the hospital right now is that after spending years welcoming families in and trying to pull families in, all of a sudden, because there's infectious plague everywhere, we've pushed everybody out. And so it's really hard to get good information about what's going on. I think remember that the person who's in the hospital is probably sicker than they're letting on when you FaceTime with them. And they're probably sicker than you realize. And they're not going to be better when they come home. We kick people out of the hospital when they no longer need hospital level care, which means they're no longer likely to about to get bad enough they need to go to the ICU. We don't keep them until they're well. And so they're not going to come home well. They're going to come home better. I think the second big piece is make sure you've got a follow-up plan in place. That ball gets dropped, and particularly as hospitals get busier, they tend to just give people phone numbers and say, you can try to follow up. And let me tell you, as a healthcare professional who occasionally tries to follow up with his own physician, it is not easy to do that. Make sure you have a follow-up appointment in place. I'd say the third big thing families need to think about is understanding the medication changes. So during an inpatient setting, we mess with a lot of stuff, and we do it for really good reasons, but we don't always document whether that was supposed to be a just to get you through the night or that was supposed to be a permanent change. And so you need to make sure you understand what are the medicines that they came in on are supposed to be stopped forever or supposed to be stopped for a little while, and what are the new medicines, and are those forever medicines or those just for a little while medicines? Because there's a very good possibility that the giant stack of discharge paperwork you're going to get isn't going to make that clear. And honestly, your poor primary care doc who's going to try to get through like 500 pages of nursing notes on the backside is going to have a lot of time. They're going to have a lot of trouble with that. So you can't count on the system to provide that communication. You've got to make sure you as a caregiver are the bridge for that in one of the more embarrassingly broken parts of the system.
Well, and the other things I think in terms of getting the home ready for someone is the first thing is to have a conversation with your insurance carrier about what sorts of things are covered and what kinds of equipment that you're able to get at home. Because generally, people are the main symptom that folks have when they come home from the hospital is that they feel incredibly weak, which means that you're going to physically have to be able to care for them. So if you have some concerns yourself, maybe you're not in the greatest of health or you weren't really maybe that strong to begin with, the first thing that you're going to have to do is solicit some help with that individual if that's not something that you are able to do, and understanding that it might be challenging, because now everyone is going to be concerned about COVID themselves to maybe get, the appropriate help that you need. And so there's different pieces of equipment that can also help if you do find yourself having to do this alone. So things like a shower chair, if that person may not be able to stand for a long period of time to get in the shower. That's something that can often be rented from various companies, and that's why it's important to contact your insurance to see what is covered, because that's incredibly reasonable to be able to get. And then each state generally has some sort of like a line. Here in Michigan, you can call 211 for information, and they can help to get you connected to different resources that you might need to be able to care for someone at home, or to be able to even self-isolate with COVID at home. Having some of the things that we talked about earlier, like maybe managing some ongoing symptoms once they come back. Sometimes people have a lingering cough for a little bit and still, in addition to feeling fatigued, just get winded very easily. So thinking about keeping them from falling at home. So it might mean that you might have to pull up some of those area rugs in your house and move them out of the way temporarily, so that you don't have any a place for people to trip. Thinking about where the pathways are to common areas, like getting from the bed to the bathroom. Is it a clear path, and is it stuff that they can kind of hold on to if they're feeling tired? And is there anything loose? And making sure that you move things that are loose, like maybe a little dressers or nightstands that is easy to trip over. Making sure that, like, if you have small kids, keeping toys and things out of those common areas as much as possible. And then planning ahead for meals, because when you have somebody that's sick at home and you're kind of trying to check on them and make sure things are okay, the more meals that you can maybe have pre-done. So having some stuff in the freezer that's ready to go, thinking about stuff that's really easy to prepare, or finding out how to use different services. So if you've never used things like Uber Eats or some of these other services where you can order from a restaurant and have it delivered to your house, learning how to do that now, whether it's downloading the app or figuring out how to like call and get things delivered, and connecting with your local social organizations, places like your church, where they may have, a program to come and like drop off meals, and it's okay if you haven't been there in a while, they still love you. And so that's okay. They haven't seen you in the month of Sundays, and you say, hey, we sick and we need some help, they'll come through. So it's important that, you utilize everything that you have available to you to help to support you during that time.
Yeah, and if we have time, I can chime in a little bit about preparing kind of mentally and emotionally for this transition back home. One thing we're definitely seeing, especially if someone has an extended hospital stay, is they're going to look and feel different when they come home. I think people often have this idea that when you leave the hospital, you're well. Uh, but it means you're well enough to go home, but in many cases, you're still not feeling very well. And you may have lost weight. Your clothes may be a little bit baggy when you're coming home. And sometimes that's hard for people to realize coming out of the hospital, that they see themselves differently. And as Jack was saying, as the caregivers are not able to currently be in the hospital with the patient, it may be quite jarring to see your relative if you haven't been able to be seeing them on the day to day in the hospital setting. When you go to pick them up, it can be, this person can look quite different. So kind of just mentally preparing yourself for that, but also realizing they're home, they're well enough to come home, and what a wonderful thing that is, and thinking through how you can support them kind of as they're processing through the changes in the fatigue that Sheria was explaining, and then also kind of the mentally and emotionally wrapping yourself around some changes that you've experienced. And as Sheria was sharing with kind of friends bringing meals, I think for many people, you'll realize that your social support network will be really instrumental for you in providing emotional support, but also like instrumental support like bringing meals or helping with errands and things like that. One thing to consider is that sometimes that can also become overwhelming. When someone comes home from the hospital, people are overjoyed. Everyone wants to call and check in and see how the patient is doing, how the caregiver is doing. And, you know, as a caregiver, it's okay to not answer the phone sometimes too. I would keep that in mind that, you know, you could be on the phone all day long, filling in friends and family on the status of the loved one. And that can be also exhausting. And so it's good to utilize your networks, and your networks are going to want to be there for you, but you don't have to be in contact with them at every moment and every day. Remember to care for yourself and take breaks too. Something some of our caregivers have done is kind of allocated someone else in the family or a friend to be that point person to share the updates on how the person is doing by email or by text or social media, to take a little bit of that burden off of yourself. And also to let the friends and family know, like, we're excited to talk to you. We're so grateful for everything you're doing, but we also need some time to rest and recuperate. So all that to say, our support networks can be so helpful in emotionally and mentally giving us a boost, but also just remember to not let it get overwhelming. And then another thing that we've been seeing too is actually some stigma, which is quite disheartening for people, especially if they need to go and have a follow-up appointment. Maybe the person checking them in is going to be quite shocked to realize that they had COVID, or maybe even still positive for COVID. And some even friends and family members may feel uncomfortable getting close to that person because of them having COVID. And so this can also be hard for people to kind of manage and deal with. Remember, everybody's handling this situation differently. We are all facing the challenges in our own unique ways, but you know, keep in mind what you can do safely. Can you have friends and family do a drive-by visit or have chairs out in the lawn? You need to see, it's going to be encouraging for the person who's come home from the hospital to be able to still see their loved ones. And so as much as you can facilitate that in a way that's safe and that's comfortable for all parties, that's going to give everyone a real good mental boost as well.
Yeah, I just want to emphasize two other things that I heard from both Sheria and Amanda that I've learned. The first is that, like, when we talk about caregivers, we don't just mean sort of the Leave It to Beaver nuclear family, right? That it takes a community. And so sometimes that means working with the person in the next room, but sometimes that means thinking about how you reach out to folks who are elsewhere in your community and stepping up, and then allowing others to help you. As a helper, it means remembering on day 2, just about everybody's got enough help. And on day 20, nobody's got enough help, right? And so thinking about yourself, not how do you smooth, right? How do you flatten that curve of help so it goes on for longer? You know who in your network is the person who's going to be talking to anybody every way. So maybe help use them to get what you need, as opposed to let them just do their little thing that's so can be frustrating, right? Use folks and accept that help. Let them give that to you. I'd say the second piece is remembering that there are some broken parts of our healthcare system, and outpatient insurance reimbursement for transitions of care is among the most broken parts. So I am quite sure that my employer at the University of Michigan does not endorse the following statements, and Kelly, you'll decide if you have to mute me anyway, but be ready to go to war with your insurance company in order to get the care you're entitled to. We have heard so often about folks not being told they can have either the shower chair or the commode, when honestly, they've been paying for insurance the whole time. They're entitled to both. We have heard so often about people finding that their physical therapy just said, well, you're done because your insurance company's not paying anymore. And you're like, well, but I still can't walk. And they're like, well, I guess this is your new normal. And no, it's not. And so being ready to remember that insurance companies are businesses. We incorporate them as for-profit businesses. They are literally obliged to try to say no to spending money as much as they possibly can. And one of the things you or your loved one, who again is not from helping you clean the toilet and make dinners, can do is go to war to make sure that you get all the benefits that you've been paying for all the years, and be really to push for not just your hospital care to be covered, but for the equipment to come home, the home nursing that is such an under-respected but such an essential part of healing, and ongoing physical therapy with someone who knows how to think about hospitalized patients and older patients. The physical therapist, bless their heart, who helped your niece, right, rehab her knee after she was doing volleyball, got her volleyball injury, is not necessarily exactly the same expertise as a person who's going to help a 75-year-old start walking again after they've been getting out of the hospital. And so making sure you're getting the equipment, the home nursing, and the physical therapy, in addition to the medication and follow-up care that you're entitled to.
Great.
And the other thing that I just wanted to also mention, because sometimes people who aren't in the home but are concerned about like a relative that has become sick, or friends that have become sick, are always wondering about what they can do. And we frequently run into people who you call and you check and they say, "Oh, everything's fine. Thanks for calling." Don't stop checking in. So they may not answer the phone. Send them a text message, let them know that you're thinking about them. Whatever your framework of beliefs are, send them some encouragement from within that framework. So if a scripture is helpful to them, if a prayer is helpful to them, send them those things. Drop off a meal. If you and ask them, don't ask them, "Can I drop off a meal?" Ask them, "What is it that you eat?" And go drop it off at the house for that person, because they're not going to be forthright about what it is that they need. So just go ahead and do it, and they can put it in the freezer if they already have something prepared, and have it for later, and make yourself available. And the more you make yourself available about things that you can realistically do, then you'll see that people will become more accepting of that, and you can be a support to that person. And maybe the only thing that you could do, maybe you can't cook, you don't have money to send them a meal, you can send them a text message to tell them that you're thinking about it. And that might be the most important thing that gets them through, is that they got a message from you every single night that says, "I'm thinking about you." And and maybe they don't respond to all of them, but they or any of them, but they got them, and that makes a difference.
Great. So there's a question about online resources and special programs. We will be including a list of resources for folks to look at, but are there any particular resources that you all wanted to mention for people with COVID or caregivers of people with COVID?
Sure, I would mention some support groups. I mean, I think one of the benefits, if we can call it that, of this time is that a lot of things have turned virtual. And so certain support services that maybe you had to access in person in the past are now available, like telehealth, if you need some mental health support, for example, or also support groups, which we tend to think of people sitting around a table in a room together. Many of these resources are now online, so you could participate just like we're doing on today, online virtually. And it again on our Heart website, which should be linked on the page that Jack mentioned earlier, so heart.isr.umich.edu, we actually have a full resources page there, of all kinds of resources for people who are dealing with COVID and also caring for someone who's dealing with COVID. But importantly, I wanted to draw attention to actually those support groups. And so I know there's two virtual that are pretty well known, the Survivor Corps and the Co-Recovered groups. And we have a full list of support groups that are Michigan specific, that are national, and some that are even international. So if you go to our page, you can find a full list there. One maybe disclaimer is some of these being virtual, they're private groups, and sometimes you need to have like a personal account to something like Facebook to be able to log in and access these resources. But I mean, some of these like Survivor Corps have thousands of people who are dealing with things similar to you, and sometimes just getting a little tidbit, or even just hearing, someone else is facing the same thing you're facing today, can be helpful to know you're not in it by yourself, and can help you get some helpful takeaways to deal with this journey. So check out our page, and we have a lot of resources there that you can look into.
Also, if you have questions about coronavirus, testing, antibody tests, and all those sorts of things, one of the authoritative sources to go to is the Centers for Disease Control and Prevention. That's cdc.gov. And you put in coronavirus into the search. I believe now, if you go to it, usually is the first thing that comes up, even if you just go to cdc.gov. But there's tons of information there of anything coronavirus that you might have a question about. And also, most of the state pages have a coronavirus page on your state pages. So if you go to michigan.gov and put in coronavirus, we have our own information here in the state of Michigan that's connected with local resources as well as testing centers. The testing center information is also available on the cdc.gov pages. And then if you have questions about like how to talk to kids, or your kids are asking a lot of questions, CNN did a really great town hall with Sesame Street that addressed kids, and it's a 6-part series. So you can go to the CNN pages and then just put in there Sesame Street and coronavirus, and that series will come up if you want to take a look at that to see what may be helpful to like have your kids look at if you're starting to get more questions with younger children that are perhaps doing some sort of hybrid version or missing being in school and have, questions that you aren't able to easily address.
Within Michigan Medicine as well, if you go to the main Michigan Medicine webpage, I think pretty much every department and specialty within Michigan Medicine, exactly as Sheria was describing with the CDC, across the top of the page is going to have a little runner that you can click on for information specific to COVID-19. For example, within my own department of psychiatry, we have that, and we have resources for adults, older adults, and children, exactly as Sheria was describing. One of the resources one of the teams in our department has developed is a coloring book, a story coloring book that talks about COVID-19 with young children. So lots of resources available through the specialty departments as well as Michigan Medicine page generally.
Great. You actually proactively answered a question about what to tell kids about the virus. I know a lot of people have little ones at home who may be confused or wondering what's going on. So that's really helpful. Um, so this is a question about the ICU. What are the potential psychological effects of being in an intensive care unit with COVID? Since most hospitals don't allow visitors or strictly limit them, what about long-term physical effects of being in an ICU on a ventilator or other supportive care?
Yeah, it's a great and hard question. So I think one of the hardest things is I have to talk when I'm answering this question in probabilities, which means some people are going to have bad things and some people aren't. And so nobody is immutably fated to have one of these outcomes. And this is a place that we need to learn more about. It's one of the places where if people can share their stories of recovery across different times, we can hear what's important to patients and caregivers and hearing their voices. Because honestly, sometimes when a bunch of old guy scientists sit around a table and we decide what to measure, we don't always measure the right things. Because sometimes what's important to me in my world isn't necessarily what's important to other people. So here's what we know. So we know that the combination of being sick with this virus, particularly on a ventilator where you might not have enough oxygen, is rough on the noggin, right? That the brain goes through, and a lot of people experience what's called delirium during this time. And during that delirium is often really, really scary. Some people's response to that is to shut it out and not speak of it. We all heard of our grandparents, right, who went through World War II or went through other kind of horrors and whose response is to never speak of that. Doesn't mean it's not there, just means they're not talking about it. Other people just don't remember because they got so stoned from all the meds that we gave them that they have no recollection of their ICU time whatsoever. Doesn't mean it doesn't have consequences, just means they're not going to remember that. Their body may know anyway. I could talk about this all day, so try to keep me a little focused, and you'll need to every now and then give me a wind it up sign, Kelly.
Okay, we have about 5 minutes, so.
All right, I'm going to get that in a minute then.
Okay.
A lot of people some feelings of depression are very common. Feelings of just not being right in your body for all the reasons Amanda talked about, are very common, and it's hard to sort out how much of that's because your body's genuinely different. You have 20% less muscle mass and 40% more water on you than you used to, and how much of that's depression. Some component of post-traumatic stress, often re-energizing previous experiences, particularly for folks who are survivors of sexual trauma or survivors of other kinds of violence, are very common. Not that the ICU was violent necessarily, but so much it brings back the other stuff that you'd managed to put away in a box. And then just fogginess, like the brain just doesn't work right. You used to be able to do math, and you can't do math near as quick. A lot of that's quite bad in the first couple of weeks. People expect that to be bad in the first couple of weeks. Many people will recover. A key component is making sure you get off the couch every day. Right. So I'll end with this, right? Like your mama taught you when you were young to wait until the virus was gone and not push yourself too hard and wait until you feel back to yourself. And that's great advice if you're 9. If you're 49 and you spend a week in the hospital, you're not going to feel right when you come out. And if you spend another 3 weeks on the couch, you're not going to feel right either. And so you need to get back to work. You need to get back to moving, and in a slow way, like start rebuilding your couch to 5K by the just get off the couch part. That middle-aged and older life, it sucks. Oh my God, exercising at 47 sucks, but you got to start somewhere. And if you wait until you feel all the way better, you're never going to get there. So you got to not go out and be an idiot and try to run a Boston Marathon the first day, but you definitely got to go out and get your heart rate up for 20 or 30 minutes and then rest. And then the next way, go a little farther to get your heart rate up for 20 or 30 minutes and then rest. And just try to ratchet that back up using whatever you need to do, you were told to do to lose weight, or whatever else you were doing in your 40s, 50s, 60s, 70s, to just get back and moving. Because if you just sit and wait to heal, you're not going to heal, because that's not how middle-aged and old bodies work.
Yeah. So we have 2 minutes actually. If any of you have anything to add or you want to close with, this has been a great discussion.
Yeah, one thing I'll close with is just sharing a little bit about the outcome of the research that we've been doing. So as has been mentioned a couple of times throughout our chat, the 3 of us are part of an investigative team doing research, collecting the stories of patients who have been hospitalized with COVID-19 and one of their family caregivers. And so we've been hearing from them across their journey of getting sick, through their hospitalization, through their time now recovering at home, and hearing it from both perspectives has been really enlightening, and so gracious of those individuals who have already participated in our work to share their stories and help us learn. Because what we're trying to do with this information is learn what are some of the gaps in the system, what has not gone well for people, what has gone well, and how can we improve this for future patients who may be hospitalized with COVID-19 or even something similar. So one of the outcomes of our research is actually going to be a workbook specifically for caregivers that we plan to widely disseminate starting in November. And so if you're interested in that resource, keep an eye on our website, heart.isr.umich.edu, and you'll get more information about that workbook there. But that workbook is specifically geared to take what we've been learning about assisting caregivers, helping them provide the best care they can across this journey of someone having COVID-19. And that is our goal kind of as a team, is to take your stories and to help provide better care in the future. So thanks for those of you who have participated. Check out our website and keep an eye out for that resource.
Yeah, it's super hard. And just like it takes at least 4 of us to talk about all of this, it takes more than one person to take care of people. So build the community, build the team to take care of people.
And remember, this is temporary. We'll get through it. This isn't the first pandemic the world has survived. You know, there's nothing new under the sun. Things might not look different tomorrow, but there will be a tomorrow. So just keep moving forward and keep pressing on.
Great. Always important to remember. Thanks everyone for joining us today for this excellent discussion. The website again is heart.isr.umich.edu. And I hope you all have a great morning and be well.